According to the U.S. Census, African Americans make up 44.2% of the population in Pennsylvania. African Americans, especially men who come from poor backgrounds, often receive poor health education. They lack the comprehensive understanding about healthcare, which leads them to take low-cost health insurance without complete coverage. These factors contribute to poor health outcomes. The solution is early health education in children and new parents. Located in the heart of Philadelphia at 1500 Market Street is the Health Promotion Council of Southeastern Pennsylvania. Their program, Focus on Fathers, spearheaded by Larry Woody, helps men become better, more informed fathers, all while taking care of their health.
Enrollment piece is very clean and neat. You know, if a guy's interested, he can refer himself or a social worker can refer him. It's all done online. I mean, we have a referral form. It's either SurveyMonkey or Survey Gizmo for that. But you simply just go to www.focusonfathers.org. That's our website, and there's a link there for referrals. And you can click on it. Anybody can do it. I'm saying even the guys we're dealing with who are very often street guys, you know, but they can do the survey form. It's basically name, address, or whatever. They fill that out. It immediately sends an email to me, and I will assign it to a case manager. Case manager's job is to contact the guy within 2 days and explain to him what we offer. And
Focus on Fathers can connect men within the program to other services offered by PHMC. There is a department on nutrition, health access, recreational activities, and more. PHMC has 3 healthcare centers at their disposal where the men can seek care.
We also have a class at 4025 Chestnut Street on Thursdays. Most of those guys are voluntary. They're doing it because they just want to be a better dad. You know, which is nice to see. You know, see, the thing about men is, you know, and I've learned this over the 10 years. Men don't ask for help. You know, and very often, even if you bring it to them, they still don't follow through.
Health coverage is especially important for African Americans because they often have worse health status than their white counterparts. African Americans live with chronic conditions such as diabetes, heart disease, and HIV/AIDS at far greater rates than any other racial group.
Most of them have some kind of insurance. You know, I think nowadays, because you can almost, well, with Obamacare, you kind of had to, right? You know, I think. But lots of them aren't. You know, lots of them have seen when you ask that question, when's the last time you've seen a doctor? You'll see never sometimes. You know, and that's why we do this work. You know, we try to help the guys get stable. You know, if they need a job, we're going to try to help them. If they need counseling, we're going to try to help them get that. Everything we offer is free and voluntary. You know, I mean, they may be ordered by the courts, but as far as we're concerned, if you don't want to come, you don't have to come. You know, we're not ordering them to do it. We might advise that you do finish this. But there's a lot involved, you know, but it's an important initiative that I wish more people would get behind. A lot of people have never heard of our program. We've been around for years and years and years. But it is just not a priority with people. But it's black guys and it's Spanish guys. You know, mostly that's who we're dealing with. And these are generally, you know, poor guys, you know. The health piece, because we're part of the Health Promotion Council, is a big deal. So when we first meet the guys, we have them do these surveys for us. And some of the questions on there are, do you have a doctor? When's the last time you've been to see a doctor? Do you have trouble, you know, have you had days where you didn't have anything to eat? But we're also asking, you know, do you have high blood pressure? You know, but a big deal is, do you see a doctor? Because guys don't go to the doctor, you know. I'll tell you this, I didn't go to the doctor until my son was born. Since my son's been born, I go every year because I can't let anything happen to me. I got a child. You know what I'm saying? That's how a child can change things. When we do men's health, we're basically, because there's one class, it's called men's health. I think it's like the 3rd class. You know, so we're talking about their health. But we're also going to go over, you know, what they need to do to take care of their child. We try to be as holistic as we can. You know, and basically you can only help a guy as much as he asks for help, or, you know, he tells you what his needs are. But, you know, it's important, you know, we just try to stress to guys that their health is a big deal because they have children.